to shine through in between the ribs and the liver, and then goes through the kidney. And the space between the liver and the kidney space, we will have to look for fluid. Okay? And once we've done that, look at this. This is where your probe was, and shining the beam of sound to the right hypochondrium. And this is what you see, and this is the liver, this is the kidney, and in between you've got a space which, if filled with free fluid, will appear like this. This area jet black. Okay? So have a look at this image first. Okay? Okay? Posterior, these are the potential spaces that we must recognize and see. Okay? I'm sure it is very clear by now. Let's move on to the next one. Okay? And there is no fluid in the left quadrant. So that's the importance of going above the screen as well. Pointer is pointing towards patient's right, and then the pointer is facing by patient's right, and the beam of sound is transversing through the bladder. Okay, I will show it to you again. And it's literally the probe always touches the pubic symphysis. This is how low we have to go. Okay. Below the uterus if we can. So I'll repeat the image again, so have a look and see how the probe position is going, spanning up and down. That's from the head end to the foot end, and literally at the foot end at 45 degrees is probably the angle of the probe where you'll be able to see the bladder. Okay? Again, and this is how it will appear. Like most of the people here don't understand the relevant anatomy of the bladder and the rest of the organs, and this is how it appears like. Okay? So I have watched for it again and again. It's very important to understand. Once the bladder is filled, the uterus is pushed much more posteriorly. Okay? I have to see free fluid. Any free fluid similar to this, jet black. Okay? Digital view of the pelvis. Now the probe marker is pointed towards patient's head. Okay, this is head end, this is foot end, and this is how you will appear. And you fan the beam of sound from right to left. Okay, you can see the uterus just lying over here. And the uterus, you see that? Positive this area, so you can see the better view. Image appearing. That's pretty good for you. Okay? You can't miss that. Anything which is black outside the bladder, most likely is a free fluid which is surrounding the rim of the bladder. That's free fluid. You should not be missing in this. And that's the sagittal view. And you fan from right to left on each free fluid, liver, and heart. There is no free fluid. This is the area we look for. Again, I will say this. This is a very, very important image. This is the pericardium, the liver, and right side of the heart, and the left side of the heart. This is the left ventricle. This is the right ventricle. This is the right ventricle, and this is the left ventricle. Okay. This is the right atrium and the left atrium. Again, this is very important views. I'm just going to repeat once more. Going through the liver. The liver is on the right side. Okay, and this is the right side of the heart, adjacent to the liver, and away from the liver is the left side of the heart. So it should be an operator. What you're looking for is the left side of the heart should be always bigger than the right side of the heart. If the right side of the heart is bigger, that means there's some kind of obstruction in the outflow of the right side of the heart, like a pulmonary embolism, and that is dangerous, and that will increase the right side of the heart. But this is a normal view. Again, normal view one last time. Perfect. Okay, we move on. Anteriorly, going on. Right ventricle, left ventricle, mitral wall, aortic wall, left atrium, aortic root, and 1:1:1. So many things that you can see in this image. Right ventricle, left ventricle, aortic root. If there is any aortic dissection, you can pick up and in the ascending aorta. If there is an aortic dissection in the thorax, in the descending aorta, see this circle image. This is the descending aorta. If there is a dissecting flap going through, you will know it. So you can find aortic dissection in the thorax by just looking at this image, which will be focusing on the aortic ascent and aortic descent over here. This is very important from exam point of view as well. They will show you the image which is or long axis view, and they will show you a pericardial effusion somewhere around here, the pericardium, and they will ask whether it's a pericardial effusion or it's a pleural effusion. Okay, and the difference between the two is you have to identify the descending thoracic aorta in the long axis view, and this is like almost every exam that you will take in your world, whatever board exam it is, they will probably ask you this question. If you see the descending thoracic aorta in the long axis view, and the pericardial fluid is present adjacent or anterior, so this is anterior, this is posterior, anterior to the descending thoracic aorta is pericardial fluid. If the fluid is present below the descending thoracic aorta, meaning it is somewhere around here and the glistering white pericardial membrane is clear and white, that means it's coming from the pleural cavity. I will show you what I mean. We'll have a look at it once more and then we'll move on to the next slide. So this is normal. You can see the descending thoracic aorta. There is no pericardial effusion. There is no blackening, jet black appearance underneath or below the descending thoracic aorta. If it was present, it would be pleural effusion. And this is my personal best view, favorite view when you just put the probe in between the rib spaces and see this, and you can see what effects it's got. If this side is increased in size, that means it may be a PE or something obstructing, and the right side is bigger than the left side. Okay? this is what called lung sliding. Okay, this comic tail kind of signs coming below. So again, have a look. This is the glistering pleura when the patient is breathing in and out, and this lung sliding. And this is what you must see to make sure that there is non-hemophiles. I think the other important thing is, the other important thing is you have to place the probe at certain position. You have to place the probe front, anterior, lower part, lateral, axilla top, lateral, axilla, lower part of the chest. So two portions here, 2 points here, and 2 points posteriorly, similar to the anterior plane we have to take.